I'm Dr. Brad Glick, a dermatologist here in South Florida. I'm also principal investigator at GSI Clinical Research in Margate, Florida. I am so happy to be here at Winter Clinical Miami. Look at how beautiful it is here in South Florida. I want to tell you a little bit about my talk, meeting the challenges of the psoriatic patient. I introduced the topic by talking about relevant clinical findings that we see in the skin for individuals with psoriatic skin disease. We also talked about some of the very important clinical features of psoriatic joint disease, psoriatic arthritis, dactylitis, enthesitis, talked about axial disease, and some of the important clinical features that our patients have who have PSA. It's really important for dermatologists to pick up the skin findings in individuals who have psoriatic skin disease because the skin disease may predate joint disease by as much as 8, 10, even 12 years. And that's about 85% of the patients will have skin disease in advance of joint disease. We also talked a lot about important comorbidities, including the classical and also some of the emerging comorbidities like non-alcoholic fatty liver disease and chronic kidney disease. And those comorbidities are really important, particularly when we're looking at patients and not only their skin disease and joint disease, but how we're ultimately going to end up treating those patients. And so I discussed some representative cases, some individuals that were failing topical therapy. They may have been previously exposed to other biologic therapies, and discuss how we navigate through the different treatment algorithms that we have for individuals with psoriatic disease. I included my discussion talking about collaborative therapies, where I really think it's all at these days to utilizing different therapies with different mechanisms of action. And I talked about how we had a very challenging case of an individual who I've been taking care of for about 10 years, who was on a litany of biologic therapies, and we were able to cool down her skin with a new therapeutic, which is roflumilast. She has plaque psoriasis and palmar-plantar disease, and we also put her on one of the newest oral systemic therapies that we have now in deucravacitinib, and within 3 months, her skin almost completely cleared. So it was great fun engaging with my colleagues here at Winter Clinical Miami, as it always is working with my colleagues at Fred. And so I thank you all for the opportunity to be here, and I look forward to seeing you next year.